Hi everyone, my name is Donna Anslin and my presentation is on healthcare in Pakistan. Pakistan has been fighting an uphill battle after inheriting an inefficient healthcare system from Britain when becoming their own nation. Pakistan faces many health challenges in its struggle to improve healthcare. Some of the challenges they face, according to the Human Poverty Index, Pakistan ranks 65th among 102 developing countries. Pakistan is one of 5 countries in the world with the highest number of unimmunized or partially immunized kids. With 55 out of 1,000 newborns dying, Pakistan has the highest newborn mortality rate in the world. The minimal standard of health financing of gross domestic product is 1.3%. Pakistan spends less than 1% of GDP on healthcare financing. Only 27% of the population in Pakistan have full healthcare coverage, while the other 73% rely on out-of-pocket money to pay their healthcare. Population in Pakistan is increasing at a higher pace than the government can develop their social infrastructure, namely hospitals, schools, play area, roads, highways, and energy. Currently, Pakistan consists of 2 main healthcare sectors: the public or government-controlled sector, which serves about 70% of the population, and the private or private-controlled sector, which serves the other 70% of the population. Both the private and the public sectors are organized on a 3-tier system. The first level or tier is called primary health care. This is the first interaction someone has with the healthcare system and provides mostly curative and preventative care. The second tier is secondary health care, or the intermediate level. This tier covers specialist consultations and hospital admissions. The third tier is tertiary health care, which are hospitals that provide specialized inpatient care and also handle referrals from primary and secondary professionals. Some of the problems healthcare in Pakistan face are as follows: lack of adequate funds and the mismanagement of funds. The government is responsible for funding in the public sector. Not only is there inadequate funding being given for healthcare, but the money that is allocated is often diverted to projects that are politically more suitable to government. There is a low priority by the government when allocating funds to healthcare. Lack of human resources. There is a low budget for hiring, shortage of professionals available. The healthcare professionals are poorly trained. Physicians and staff leave because they are underpaid, overworked, can't get raises, and have no benefits. Many leave because of dissatisfaction. Lack of resources. There is not enough clinics, centers, and hospitals to support the population in Pakistan. Many of these facilities are have outdated equipment and closed because of lack of staff. Structural mismanagement. The government is in charge of the management of healthcare, and the healthcare professionals are subject to laws and policies set by the government. Corruption and favoritism in hiring of healthcare professionals. And last, the lack of medical research and technology. There is no implementation of healthcare policies, standards of care, improvement of care through research or national technology for healthcare records. With so many problems and challenges that the healthcare system faces, what can be done to improve healthcare in Pakistan? And what does the future hold for the healthcare in Pakistan? Here are some things that are being implemented or talked about to improve healthcare in Pakistan. Electronic health records. Currently, there is no electronic health record system in place in Pakistan. In hospitals, little technology is used and paper is still main way of charting. There's no way to exchange information. There's a 5-phase system that is being considered to help Pakistan employ a national healthcare information system. Public privacy partnerships are also being considered. This is where arrangements between government and private sectors share in investments, risks, responsibilities, and rewards as they provide improvement in public infrastructure, community facilities, and other services. Retain and recruit healthcare professionals. This can be done by providing equal pay to that of other government employees, provide benefits and incentives, offering raises, and providing appropriate training. Allocating more funds for the health care. This can be used to improve existing infrastructure and build more clinics, centers, and hospitals. Continue to work toward universal access to health care by expanding the programs that provides health cards and government subsidies, health insurance for poor and needy families outside of Islamabad to other provinces. Change central policy making to a district level so local districts can implement standards of care specific to their areas. Other areas that would be helpful would help improve healthcare in Pakistan are to control growth population, increase literacy rate, and promote health education. Even though progress to better health appears to be slow, Pakistan does appear to be working to improve their healthcare system. As they continue to implement the improvements in their healthcare sectors, the healthcare system will become more efficient and effective to the masses. The Pakistan people will benefit by being provided with effective, efficient, safe, quality health care. Thank you for watching my presentation. Here are the references that I used. And here are the photo credits. Thank you.